Hello and welcome to another episode of Dentistry Unmasked. I'm Pamela Maragliano-Muniz. With me, as always,
Hey, David Rice here. How are you, Pam?
I'm doing really well. One challenge that I feel in my practice is navigating the sleep story. It's one thing if you have somebody who's generally healthy and then you kind of identify that they have sleep disordered breathing. You can sort of just address that. But what about the patients where you have a restorative concern or periodontal concern and there's sleep? Like, do you adjust sleep first and then jump in and provide your restorative care and then come back and revisit sleep, or do you just kind of do all your restorative things first while they're dying in the middle of the night sleeping for months or years and then address sleep? There's got to be a really smart, effective strategy to provide this care.
Turns out we might know somebody who can help us with this week. So we're very excited to welcome you, Dr. Maria Skolina. How are you today?
Thank you very much for wonderful beginning. I'm very excited to be here. And the topic what you brought up is very close to my heart, because guess what? Sleep patients very often, they also have a lot of periodontal concerns, just like you mentioned, and restorative concerns, especially in the area of vertical dimension, because correlation between temporomandibular joint disorders, what represent in a clenching bruxism and, I would say, call it horizontal fracture, it's a, mutual correlation. People with a sleep disorder have a lot of, damage like that. And people who have a lot of damage like that, very often we identified sleep disorder. And there is another wonderful reason to address those, disorders. I would say it's a tongue. Tongue need to have enough space in the mouth to be able to stay in the mouth rather than in the airway. And yes, restorative dentist can help in that department, as well as if somebody has a lot of crowding, it's also, I would say, difficult for the tongue to reside in place. And I wouldn't say just restorative, I would say restorative in combination with orthodontics can help with that.
Yeah.
So orthodontics makes sense to me. I feel like, okay, there's crowding, there's inadequate tongue space, inadequate tongue posture, maybe a vaulted palate. I feel like, okay, we're going to address that orthodontically and sometimes in combination with surgery. I feel like that makes sense. And then you jump in and then obviously address sleep after if you're going to need to provide a device. But what about for restorative? Do we sort of try to get them, do you work out their vertical with a sleep device first and then jump in with your restorative? Or do you like saying, nope, let's get the teeth in the position that they need to be in, restore the teeth, and then let's then retest and then address sleep as needed?
It's a very, very hard question. I would say $1 billion question, because it depends what your level of trust with this particular patient. A lot of, I'm going to, talk about two categories of patients what I have in my sleep practice. And I'll start with the first category of patients which actually refer to me by medical provider. And that category of patients who come to me just for sleep. And yes, it's true. I might see a lot of restorative needs. But for me, the first thing first, they are here because they cannot sleep well. And I have to do two things. I have to make them feel better with a better sleep, and I have to establish the trust. And if they refer to me, they might have a dental provider who I have to establish a relationship as well. This is a very, it's an ethical point. And I usually, in my first consultation or comprehensive exam, will point out to the patient what I have some concerns, and I share with the patient, and then I share in a letter and in a phone call with the dental provider. And that might not be only, just like I mentioned before, vertical dimension. It might be also not enough retention. It might be not enough teeth, or I need implants to be placed. And I would say we can start with the device, but since sleep apnea is a lifelong disease, we might need the improvement in that department. And I start that conversation this way. There are some patients who might not have a dental provider. They say, I didn't visit the dentist for 10 years. Okay. And this is the category of people who I think you both would be very interested. So I have to do the appliance and be very strategic. I have to do the treatment plan for this patient and incorporate it in a design. Of course, I cannot, I'm not a psychic. I cannot predict exact dimension of the tooth, but I have to explain to the patient, what are your plans? Like, you see, you have a broken number 14, you have a broken first molar, you have this and this and this and this, half tooth here, missing tooth. And patient might say to me, I'm just, I have a lot of concerns to being in the dental office. That's why I don't have a dentist. Then I said, okay, if we're going into the right direction, I'm gonna include the ideal shape of the teeth in the appliance. So they're not going to make appliance on a broken down teeth. If some teeth need to be removed, they're going to be excluded, from the design, and patient not planning to restore that. But if some teeth we're planning to save, I'm going to ask for ideal shape. And then if patients have their own dental provider, I'm going to explain that to dental provider, but they have to use my device as a guidance for the shape of the future restoration. They have to scan the device, from inside, and they have to ask the lab to replicate what I already have. Or, if it's going to be myself, not myself, if it's going to happen in our office, then we're going to use that as a guide for future restorative dentistry. And there is a very difficult question about vertical dimension. That's a long story. If I have to explain that to dental provider, that's one story. I explain, and things like that, that's a major, full mouth rehabilitation. And patient who doesn't sleep well might not be ready to do that right away. So, it have to happen, over time. And there are some different roads, the different sides, or different paths it can take, this particular treatment plan. But I can talk about cases what I restore a vertical dimension and orthodontics while patient was in oral appliance. So while we control the sleep, that's the longest road, and I'm happy to share that.
Yeah, so the typical person who's coming to you, it sounds like in a perfect world, they get their dentistry done, then the appliance. But if not, then we've got to pay particular attention to that appliance and scan it, try to retrofit it as close as possible. Have you had good success with that? Like, I would imagine that's hard to do when you're working with another dentist and sort of relying on their ability to do that, or have you had good success with that?
I cannot say it's very difficult. So appliance can be done in two ways. It can be made of acrylic, or it can be printed. So if it's done with acrylic and restoration, like we're talking about, 3-unit bridge or single restoration, then either dentist have to keep an eye on the appliance and make sure the restoration fit to the appliance, or very often they send this patient to me and said, please fit, make sure the appliance fit. And, I have to work with that. Appliance have a long lifespan. 5 years, according to the Medicare, according to some private insurance, in 3 years. And it's even hard if patient has a dentistry, but then something happened. Nobody guaranteed they're not going to get decay over, that lifespan. And we have to be ready to modify the appliance. And with acrylic appliance, you just remove the acrylic from inside of the appliance, make sure it fits passively, absolutely no balancing in the mouth. And then you can use the acrylic and reline and make sure patient have a perfect occlusion. You have to check with articulating paper, make sure it would be no interferences.
Excellent. I want to go back a little bit. So you have limited your practice to sleep medicine at this point. Is that right?
We can say most of my patients sleep. I cannot say 100%.
So how does that look? What does that look like? I feel like a lot of general dentists feel like this has to be part of their practice, so they're kind of half in, half out. What was your journey like to get to that point where you're providing mostly care on sleep patients?
That was an eventful journey, and I really enjoy it. Uh, uh, it started 15 years ago. And it starts from restorative point, just like I'm here because it starts from restorative point, because I really was scared about my dentistry being damaged. And that's kind of, I got into ortho and I love to move the teeth, they're going to be functionally in the right position. And then, people still were able to damage, orthodontic work or, restorative work, what I provide after that, and even in the presence of the guards. And I learn about sleep. So with the sleep, and there are two things. What if you want to start that journey, you have to believe in two very important strategy. Medical billing is not a dental billing. That's going to be totally new chapter of your life to accept that philosophy of medical billing. And you have to create a systems in your practice, what they help you to navigate that case towards the medical billing. It's not going to be like you put the code in Dentrix or in any dental program and the claim going to go and then you're going to get the payment you kind of expect. It's not going to happen like that. It's going to be a big learning curve and you have to learn how to create a system in your office, what the patient get, insurance, either information about the insurance or, your work get reimbursed, depends if you want to do fee for service or if you want to help patient. And the second thing is collaboration. And both of those philosophies take long time. You have to establish, on the second part, you have to establish your relationship with the physicians. And that's also going to be another exciting journey. Because they're not going to, for a lot of physicians, they look at us as a totally different world. We cannot be part of the medical picture. But slowly but surely with your efforts, it's possible. A lot of young physicians, nurse practitioners and nurses who deal with the patients on sleep, that's kind of a new wind in this world. So it's not only physicians, it can be nurse practitioners and nurses because they have that trust relationship with the patient. You can, establish a relationship and then you're going to enjoy really comprehensive care.
So I think a lot of dental professionals find that aspect like really challenging. Like, are there things that you did to build those relationships that worked better than other things? Like what were a couple of the things that worked the best for you?
I'm going to start what works the best for me. Whenever patient come to my practice, dental patient or medical patient, we always interested about physicians around this patient. And we put the names of the physicians in our database. And then I have a team. It's not only me. You know, a lot of times dentists who said, you know, how I'm going to start to sleep, I'm going to try to do everything by myself. Or, you know, I have this front desk person, she has to connect me. That I think a big mistake, because you have to have a designated, you know, team or the person who's going to be just on a collaborative aspect. So we have physicians, we put them in a program, and names who I don't know, you know, and new names, I always ask to connect me. You know, our life is busy and physician's life is busy. So it might not happen right away, but you have to keep trying to connect with a physician. And then when you connect with a physician, you explain about how we can help each other with our patient base. But very important, but we have a mutual patient. I think that's very important. But there is a John Smith who I can help in such and such way, not necessarily with the sleep, but maybe with periodontal health, maybe with the sleep, maybe with the salivary testing, what I just did, and that reveal X amount of, you know, bacteria, what can be very stubborn, what can play important role in, for example, cholesterol level. Or, you know, you think this bacteria grows in the mouth in the absence of nitric oxide, and you can mention that to the physician. So maybe there is a suspicion about sleep apnea. Maybe it would be a good idea to do the sleep study. So that avenue work really well. That's number one. Number two, you have to stay in the memory. It cannot be one connection and that's going to be your, you know, okay, we connected. No, it's not going to happen like that. Every 6 months, I have to remind the doctor about myself. And yes, I do it in a pleasant way. I want to create a pleasant, you know, memories, I would say. I want to create a good impression with that physician. And this is what I learned from the book Giftology. And unfortunately, the author passed away, but he left a very, you know, unforgettable impression in my head. So he recommends, you know, a lot of dentists love to send the gifts and they would say, Dr. Skolina, Dr. Skolina this, Dr. Skolina that, for the physician. You know, maybe they talk to Dr. Skolina on the phone, but that's not the reason he's gonna keep the pen. He's gonna keep the pen if it's gonna say Dr. Jones. So the gift have to be personalized to the person you're sending the gift. Yeah, it's much more difficult. It's much easier to get the basket and send it the basket. You know, here we are, we spent $100 to Dr. Jones, stuff eat the basket, memory is gone. But if you would be creative and you learn about Dr. John, what he exactly like, and come up with a gift what's going to be memorable for him, that's going to give you better chances. So this is the book Giftology is about.
That's
love
that's a
that.
great piece of advice.
Yeah, I think that's awesome. So you mentioned a pen. What other types of things have you found work? Because that I think most of us want to send things with our name on it, but I can see that it does take more effort, but also you're right, it would be certainly more impactful. I want to hear more.
Yeah, no, this, you know, I read the book several years ago, and the ideas exactly what author suggests for the book. In a book, I did not find correlate with me. He really liked to send knives. In my culture, knives engraved with the name, knives or anything sharp does not correlate with my beliefs. You know, I was raised with knife only lead to breaking the relationship. So, you know, particular advice what he offered, you know, did not work for me. But then I do, you know, I know my physicians. I talk to them. I try to, you know, you cannot get into intimate conversation if you're talking first time on the phone, but over the time you kind of get an idea. But if I don't want to be specific and I want to give your audience practical advice and everything about my, you know, programs, you know, I have a Facebook channel on the YouTube, Facebook and Instagram. I try to be practical. I try to help people what they don't waste time, you know, watching me or listening to me. So I'm going to give you things what I got a lot of positive feedback on. Water bottle. Water bottle, we all drink water. We know water bottle is great. So water bottle, you can put enough letters on a water bottle. You can give your message and the person name. And it's not necessarily have to contain your name, because once the doctor or nurse practitioner or nurse see your bottle and like your bottle, they will remember it's you. If there are some gifts, like for example, towels, if we're talking about specific, they don't let you put a lot of letters on. But if you have a close relationship, we all use towels. You can put just the doctor's name, but you have to make sure this doctor knows it's from you. Wonderful thing, which I find in the summertime work well, is a cutting board. Cutting board, you can put a lot of things and it's not sharp. And we use cutting board to serve. Of course, it can be a cup. We all drink from the cup. And I can go on and on. People love candles. Candles can be engraved. But sometimes for the male practitioner, candle might not be what they're looking for. No, so you have to know your audience to be able to, deliver your message. But it's very important to be remembered. Another thing, what I want to bring the practical advice and be in the light of modern, in a modern light, I use a lot of help from artificial intelligence. I write personalized letters. I want physician know, and for me to write a letter, it takes a lot of time. But I know important points. Of course, artificial intelligence, ChatGPT, would write very general letter what would not be related to these patients. So you have to write about specific patients. You have to put your points, but then it's going to be shaped in a very polite and elegant way. What represent your style and what you want to express about therapy, what you provide for this specific patient. And it doesn't have to be sleep patient. It can be your dental patient as well. It can be related to salivary test or to periodontal disease, or even to restorative work you're planning to do. And that show your expertise and your, I would say, your passion towards your field.
Most definitely. It's interesting too, because those of you that are listening and you're like, psh, how impersonal is a note from ChatGPT? Turns out I was at a lecture and they did a research study based on a messaging that humans wrote versus utilizing AI. And it turns out humans respond better to AI generated messaging than our own messaging, which I think is a little disappointing, but I also think that if you put yourself into it, then I think that, it'll be a nice mix. I think if you, like you said, something generic that you could use for every doctor, not going to be great. But if you, give it enough points to create a message that is, personal, the AI message is actually going to be better than anything you would spend triple the time on. So I think that's a great utilization of time. And also, it's not only efficient, it certainly is effective. Now, I want to talk about the patients because I can tell you as a prosthodontist, one of the weirdest things that happen is I will have a referral sent to me. It's funny, and it's usually from specific doctors. Um, if I'll be like, oh, a patient consult from this doctor, if I could literally put money on that they have no idea why they're in my practice, it's crazy. I'm like, oh, what brings you here? They're like, I don't know, Dr. So-and-so said to come here. And I'm like, oh, okay. But I mean, that's a harder obstacle than a great referral who states the problem, states why they want that patient to come and see me and all of that. So, but those patients are easier. I feel like when it comes to sleep, people are more accepting of the cards they're dealt in many cases. It has to be really bad or their partner wants to murder them in the middle of the night, or there's got to be a reason that prompts them to move forward. Because in some cases, those therapies can be kind of costly, especially if they don't have insurance coverage for it, or if they're not severe enough for insurance to cover it. So, how do you educate the patient to get them to really understand that this is a problem that can and should be addressed?
My first discovery happened after COVID, when my consultation became telemedicine. And I a big advocate of telemedicine for the first consultation, because we have a stigma. I'm trying so hard with my articles in Forbes, with my other publications and public appearances to kind of move that stigma of dentists being so terrible. But people have it inside. It's so deeply, like on a genes level, embedded. So when I see them first time on a screen, they are in the presence of their own home. That's the big plus. Second thing, I try to understand their story. It's not about my treatment. Of course, I can explain my treatment, I don't know, with the closed eyes in the middle of the night, but it's not about me at all. They came to me for me to understand their situation. And that's how I'm really trying hard to be in their shoes. Yes, it's true what the stories are very similar. And for me, I feel so much compassion to people who cannot sleep during the night. They wake up after 9 hours of sleep totally unrefreshed. Some people wake up after 16 hours of sleep and feel they never slept. And then I look at the sleep study and I see what heart rate triple. And I said to them, no wonder it's not a secret. You run the marathon all night. And so, some people wake up, it's upset them too. You're right, murdering the spouse, that's another reason. But that's a very important reason for a lot of people. But it's not their own. Like, I have to find something what they own. A lot of times it's a dry mouth. It's a pain in the throat. A lot of people sleep with the mouth open and it's very uncomfortable and it's a disturbing factor. And when I just start that field, the main idea was what person who I'm going to treat going to be overweight or obese. But I learned it's not true. Most of my patients, they're in a very good shape and they're very young. And I find one common denominator is a difficult breathing through the nose. I find even that idea, what they have to use nose 100% during the day and during the night is novelty to them. They surprised when we discovered it during the conversation. Then I made the connection with the sinus infection. It's really unpleasant when you constantly have postnasal dripping in the throat. It can happen during the day, it can happen during the night, but it's very bad. So I try to connect with the things what important to the person on the other side of the screen. And then I work on the remedies before oral appliance therapy, what they can do for themselves. I'm going to explain to them, connecting the dots. Look, you can record yourself on a snore lab, and then you can try this, and you can find the representation of these remedies if you feel better. And when I'm trying to explain them the benefits, what they can do for themselves, that create much better connection. And I understand your point about the doctors. Like, I'm working on a referral base for very long time, and I know which patient belong to which doctor. And this is why, that's another advice, I always recommend to have a doctor on a cell phone. I recommend to ask for the cell phone number. It's very difficult to get in touch with the doctor if doctor work in a hospital facility or in multi-specialty office. Nobody have time for that. But if I have a specific patient and I have a specific questions and I have a challenges, and very often might be with the insurance, with supplemental documentation, I want to be able to reach to the top of the line. Of course, it can be office manager too. I want to be able to find the answer in a very short period of time. And I think patients appreciate that, if, efficiency, what, my practice can provide.
That's incredible.
Yeah.
Wow. I don't know how this happens, David. I mean, I feel like we just sat down and here we are almost 30 minutes in. And I have to say thank you for all of this information and really great insights. I feel like the conversation took a little bit of a turn, but I feel like you gave us more to think about and things that we can bring to our practices to have a better, more fruitful practice and a better relationship with the doctors that we refer to. So I appreciate that. And not only that, you guys, she's so sweet. She has, Dr. Skolina has given us some resources that we can use in our practices to assess sleep, and check out the show notes because I'm going to share those links there. But where can people find you, follow you, and reach out when they have questions?
I would be very honored, for your audience, for the dentist, to become part of my group, Sleep Apnea Breathing Snoring Help, on the Facebook. Of course, they can subscribe to the YouTube channel with the same name. I'm on a LinkedIn. That's how, we are connected. We got connected. And I'm on Instagram, and I put, practical advice in a little snippets where people, if they have just 15 to 30 seconds, they can learn from. And I try to share the knowledge not only through my insights, even though I want to be as practical as possible. I interview other professionals who are in that team. Sleep is a team sport. So who are in that team, and they have their view. And I want to bring their view to the picture for us as a practitioners to understand this disease of evolution better. So I would be very honored if you share through the Facebook, or if you send me the message through that, or you can go on my website, Dr. Maria Skolina, and write me email through that. And I would be very honored to help you with your challenges in the dental sleep medicine. I'm in the process of writing the book. I hope that's gonna help. I think quarter of population have sleep disorder breathing. They all are dental patients. Medical community doesn't have such a close relationship as we do. We see so much more. And we can be so useful, so practically valuable in helping people sleep. And 87% of people just walking around because they don't want to be diagnosed. They don't want to use the CPAP machine. Sleep physicians are part of my practice. They prescribe the CPAP machine, but for themselves, they use oral appliance or orthodontics.
That's helpful. Well, listen, thank you again so much. I can't wait to share your information, and we'll share the resources. And Pam, another week goes by and another week comes next week. So to everybody who's watching, I hope you have an amazing rest to your week, and we'll catch you next time here at Dentistry Unmasked.
Thank you.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.